Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic.
Researchers are now studying blood and other samples from the victims, trying to learn what is causing the disease.
The cause of the acquired immune deficiency syndrome, or AIDS, is unknown, and there is no known cure.
Quarantine will be applied where necessary in order to prevent the spread of the disease.
Before the panics of swine flu and Ebola, there was HIV. The human immunodeficiency virus and acquired immunodeficiency syndrome, also known as HIV/AIDS, was first identified in 1981. From there, it grew. Previously thought to be a kind of gay cancer, a few isolated cases of mysterious infections among gay men turned into a disease that now affects over 36.7 million people. Before we further get into the discussion of the AIDS epidemic of the 1980s and 1990s, let's first review the basics of the disease.
The human immune system defends the body against illnesses all the time. It uses guards in the blood called T cells to recognize any intruders and destroy them. But instead of attacking the body, the human immunodeficiency virus, or HIV, attacks those T cells themselves. It turns them into copy machines to make more copies of itself, then eventually kills the infected T cells. Without treatment, it takes 8 years on average for a person with HIV to develop AIDS, or acquired immunodeficiency syndrome. By then, there aren't enough T cells to fight off various infections and diseases, so it's not the virus directly, but the diseases that are eventually fatal.
I'm angry because there hasn't been enough research for AIDS, enough funding, and gay people are suffering, and it's outrageous.
At first thought to only affect gay men, AIDS was viewed by many as a sort of retribution for the supposedly sinful act of homosexuality. In 1982 in New York City, the Gay Men's Health Crisis was founded in order to provide a safe space for afflicted gay men and to bring awareness to the rapidly spreading disease. Arthur Kahn, the author of AIDS, the Winter War, A Testing of America, originally was a volunteer for the GMHC. Through the organization, he met many AIDS patients and advocates, and eventually decided to investigate AL-721, an egg-based experimental treatment originally discovered in Israel. AL-721 was met with varying rates of success in patients with AIDS. The People with AIDS Health Group was founded by AIDS patients in 1987 in order to provide access to experimental treatments such as AL-721.
It hit me one week, actually, friend number 18 died.
In this city alone, AIDS already has killed more than 5,000 people.
The inevitability is that the virus will get me.
I prepare myself for Daryl dying every day. I'll live through that and be there with him, and I still would never have it any other way.
While pharmaceutical companies such as Ethogen and Praxis squabbled over royalty fees and distribution rights, people with AIDS took action. They knew that by the time the pharmaceutical companies had their contracts ironed out and had full approval from the FDA, it would be many years too late, and thousands more AIDS patients could be dead. So, PWA Health Group members began concocting the drug in their own homes, using grocery store eggs and chemicals from local suppliers. This homemade version of AL-721 was distributed at a local church in New York City, and many of the recipients reported marked improvement in their health. In response, the FDA said that they knew what was going on in New York and acknowledged that it was illegal, but the administration made a conscious decision to ignore the distribution of homemade drugs in order to focus on speeding up the process of distributing a legal version of AL-721.
AIDS is on its way to being the leading cause of death in young people, young adults in the developed countries, and therefore stabilization at that level means that we've got a tragedy for a long time to come.
Washington said this is the #1 disease, but they're not giving any money for it. It's absurd.
It already is tearing society apart in terms of sort of putting group against group.
I'd say in the 60s, the black movement didn't win any friends by burning down cities, but they sure gained their civil rights, and that's why we're out here.
White House officials felt that the president had to speak out because the disease has become the nation's overwhelming health concern. Even his own doctor, John Hutton, urged Mr. Reagan to pay more attention to the problem.
Our battle against AIDS has been like an emergency room operation. We've thrown everything we have into it. We've declared AIDS public health enemy number 1.
By 1983, the Secretary of Health and Human Services had declared AIDS its number 1 priority. However, in that same year, the House Subcommittee on Intergovernmental Relations and Human Resources charged that the Reagan administration failed to ensure resources for AIDS. It seemed that the HIV/AIDS awareness movement was largely going to be left up to the group most affected, the homosexual community. America was already prejudiced against homosexuals before the AIDS epidemic began. AIDS was just another excuse to ostracize and hate gay people. Groups like the GMHC handed out flyers on AIDS prevention and provided group homes for gay AIDS patients who had been evicted, while gay activist groups like the Lavender Hill Mob took to the streets in order to protest unfair treatment of homosexuals and AIDS sufferers. When Ronald Reagan finally appointed a presidential commission on the HIV epidemic, his appointments were met with public outcry from the gay community. Members of the Presidential Commission included donors to the Reagan campaign, known public homophobes, and a doctor that insisted that AIDS could be spread through pets, mosquitoes, and public toilets. It wasn't until a new chairman was appointed to the commission that public opinion of the government's involvement in the AIDS crisis began to turn around.
So we want to show the President and the Congress and the rest of the country the enormity of this epidemic. And with our quilt, we hope to show that enormity by providing people with a glimpse of the faces that are behind all of the statistics.
I know it sounds strange, but there's a lot of things I've left I'd like to do.
Difficulties in widespread distribution and interruption of clinical studies caused AL-721 to eventually be replaced by AZT as the leading treatment for AIDS patients. Most patients today use a combination of drugs, and the average 20-year-old diagnosed with HIV today can expect to live another 53 years. While the future for Americans with AIDS is definitely not as bleak as it once was, in developing nations the epidemic remains ongoing. Particularly in sub-Saharan Africa, there is a lack of medication, treatment, and education about prevention of HIV/AIDS. In the summer of 2016, the United Nations made a political declaration providing a global mandate to officially end the AIDS epidemic worldwide by the end of 2030. Perhaps if we keep spreading awareness about the virus and experimenting with new medical methods like we did with AL-721, we can achieve that goal and eradicate HIV/AIDS for good.